Hello, and welcome to this Health IT Exchange Community Executive Webcast. I'm Jenny Lorello, Senior Community Manager, and today I have the pleasure of speaking with Joseph Petro, SVP of Healthcare Research and Development for Nuance. Joe has played a key role in bringing some of today's most successful speech recognition tools to the market, and I look forward to hearing his perspective on how providers are adopting these technologies to enhance clinicians' mobile experiences, as well as to simplify their mobile interactions. Joe, thank you so much for joining us today.
My pleasure.
Now, my first question that I have for you is around Apple's Siri and how this technology has seemed to really make voice recognition almost famous among consumers. Can you speak to voice recognition in healthcare? Specifically, what are the benefits and how is it currently being used among providers?
Sure. So just a comment, I think, on the Siri stuff, because I think it's important because we're starting to kind of factor this into our thinking. We think the biggest effect that it's had in the bleed over from the consumer side of things is that it's really started to get everyone, including clinicians and physicians and other domains, thinking about interacting with a system, whether it's a mobile phone or a computer that sits on a desktop in a different way. In the past, obviously, we're all used to typing on the keyboard or the little virtual screen or the little the BlackBerry device. But the bottom line is that we've all always felt in the back of our minds that that's probably not the best and most efficient way to do it. And so I think there's two things that this kind of shift has got everybody thinking about. One is, obviously just making it a lot easier to have a natural dialogue with a mobile device, and using speech, as the centerpiece to that is obviously key. And then the second thing is that what makes Siri special actually is that the fact that it kind of understands what it is that you're saying. It understands your intent. So, if you want to do something with your calendar, say, or you want directions, it understands the difference between those two different things, and it'll pop an application, or it will bring you to a set of directions or a map, or list the best restaurants, or help you make reservations or whatever. And this type of thing is it's so natural in terms of the way folks are interacting with it, and everyone's having this kind of personal experience that it really is kind of shifting all these different industries that we work in to kind of expect something different in terms of the interface. And we think really, from a Nuance perspective, we're really sitting at the center of this shift, especially from a health IT perspective. So to switch gears a little bit and to talk a little bit about speech recognition in general and how it's impacting health information technology. From a Nuance point of view, we have about 450,000 physicians or so that use our technology every day. So depending on how you count physicians in North America, that's just about 50% of the physicians. They use it in a variety of different ways. One way is basically to push clinical documentation into their electronic medical record. And as we know, physicians are heavily loaded with lots of things, and at the core of that, obviously, is treating patients. And the documentation load on a physician is more or less increasing on a day-to-day basis, and it's changed a lot over the course of the last several years with meaningful use and the regulations coming out of Washington D.C. and that type of thing. And so speech recognition is really a major productivity tool in their tool set, where they can put on the headset, they can bring up their electronic medical record, and then they can start speaking into that electronic medical record, and basically their speech is turned into text and it's converted to clinical speak, and they see it right on the screen. That's one modality. We call that front-end speech recognition. A second modality would be more of the traditional kind of transcription workflow, where the physician might pick up a phone, for example. They might say, this is Dr. Petro. I'm narrating or dictating on patient 1, 2, 3, 4, 5, and then they basically do a reading if they're a radiologist, or a progress note if they're a general medicine type of physician. And that voice file kind of flies through the ether, so to speak, through the internet. It goes through a speech recognition loop. It ends up in front of a transcriptionist to edit and check the quality. And then it comes back into the electronic medical record, where the physician will sign off on it, hours later. So, in terms of the way we work, in terms of the workflow that a physician is used to working in, we tend to be very kind of harmonious with that workflow. It doesn't feel like there's another application, yet again, that the physician needs to deal with. It's one of these things that kind of sits in the background as a core capability, and they leverage it to get their job done, and it's very impactful on a day-to-day basis.
Okay, that brings me to my next question, looking at more of the long term and how we're going to see mobile health technology, voice command, speech recognition, or otherwise, continue to push the envelope in terms of clinical decision support, relying on integration with EHRs for increased quality of care and error reduction. Can you speak to that a little bit?
Sure. So from a futures perspective, I'll jump on to the answer to the last question relative to what makes that kind of consumer experience special in terms of the handheld, basically being able to figure out what it is that you're asking, what is the intent of the question, and understanding the details of that question, so that the handheld can provide you with the action that you're interested in, like popping an application, or can actually provide you with a specific result, so that you don't have to click through a whole bunch of blue links. We're all used to that kind of search experience where the dump truck full of blue links backs up and dumps a whole bunch of stuff on us that we're not interested in. The difference in the future is really that we're taking speech and we're recognizing it, and then we're understanding what the physician is saying. And we use a technology called clinical language understanding. It's basically the application of natural language processing that's been special purposed for the medical domain. And that helps us understand what a physician is asking us for. Is a physician asking us about, say, a drug, the dosing requirements for a medication? They're looking for a treatment protocol. They're trying to pull up, say, an order set. They're trying to select somebody on the patient list. They're trying to, control the electronic medical record interface. We're releasing a bunch of products this year in that area of clinical language understanding, anywhere from computer-aided coding, decision support, retrospective and predictive analytics, and that type of stuff. And really underpinned, underneath all those applications, the underpinning technology is natural language processing, and the ability to look at any kind of unstructured text, whether it's narrative coming from a physician or a text field or a paragraph block that's coming out of a book or a report, and basically mine that for information. And then we think the next phase after that is really reasoning, right? Basically taking a number of different factual elements and making a real decision. We've all kind of dreamt about these things, especially geeks like myself, in terms of watching all the sci-fi stuff. When a human being can really actually talk to a computer, and the computer can really provide an answer back. That's really the ultimate place that we're going to, and a bunch of things have lined up as of late that really starts to put some of those things in reach. So understanding is really kind of the key next step from a technology perspective. There's a bunch of things that are happening, though, from a form factor point of view that are just as relevant. So, if you look at the fact that iPhones, iPads, all these handheld devices, whether they're pad technology, slate technology, smartphones, these are all in the physician's hands, and the physicians are carrying these things around, in their pockets. So, from our perspective, we need to make that experience that we provide, that capability that we provide, basically the same and consistent, ubiquitous, across all the different devices that a physician has. So whether a physician picks up, say, an iPhone or an iPad, or they're at their desktop, talking to a mic, that speech recognition experience needs to be the same. That understanding experience needs to be the same. The accuracy levels need to be the same, and so forth and so on. So all of our applications over the course of the last, say, year and a half have been pushed up into the cloud, and cloud computing has been kind of a centerpiece of being able to deliver, I would say, a form factor, agnostic type of a capability. And then the last piece that you asked in terms of electronic medical records and how we integrate. The interesting challenge for us, and as specifically for me in terms of running a research and development team like this, is our goal is not necessarily to be in the physician's face, like here we are, we're Nuance. Our goal is really to work in a completely, harmonized way with the electronic medical record. So we want really everything that we do to be so deeply embedded in that EMR experience that it doesn't get in the way. We don't want to introduce yet another application. When you do, when you engage in one of our, speech technologies, we want you to simply be able to, speak into the iPhone or speak into the mic and push that text into the EMR in a really highly accurate way. If we're extracting facts and we're driving some kind of an analytics workflow or whatever, we want that fact extraction loop and the driving of those facts into the analytics workflow to be completely seamless. And so everything that we've done up to this point has been underneath that kind of overarching goal of really kind of being harmonized into the electronic medical record, and everything we're doing in the future is as well. So we've got partnerships with Epic, Cerner, McKesson, Allscripts, Meditech, just to name a few, and that's the way we work with all those guys.
Now, you talk about harmonizing the EHR experience, the user experience of this technology across the devices. In that same light, what do you feel are the biggest barriers of adoption on the clinician side, on the institutional side? Where do you think that resistance is coming from, and how do you see us overcoming that in the future?
Yep, that's a great question, actually. So in terms of the way physicians, when you think about actually being a physician and all the stuff that you need to deal with, what I see happening, and I am not a physician, but I've been in this space for a while now, and it seems to me that there's a lot of things that are happening, whether they be regulations or technology or whatever, that's basically getting in between the physician and the patient. And physicians are worried about getting paid. They're worried about creating documentation that is coding compliant. They're worried about getting reimbursed from the government, and proving that they're using an EMR in a quote unquote meaningful way. These things are all extra things that if you speak to a physician and you have a heart-to-heart with them, that they cite as real issues that are getting in the way of treating their patient and producing fabulous outcomes for everybody. So one of the ways that we help with that adoption is we help the physician actually interact a lot more naturally with the EMR than they would if they had to sit on a keyboard and fill out a bunch of structured form fields. And so, to be perfectly specific about this, say for instance the physician is doing a progress note, or they're doing the patient has just come into the hospital and they're basically just documenting that first interaction. The patient presents with severe headache, and then they start to describe the different medications. They're on amoxicillin for a certain infection that they had with a certain dosage, a certain frequency, a route, and so forth and so on. And they talk for say 5 minutes, and they populate a really dense narrative that tells that patient's story. They don't want to have to go back and say fill that form out right after that and make sure that from a meaningful use perspective that they've got all the checks and balances in place so that they've documented a problems list, an allergies list, medications, social habits. So our natural language processing, our clinical language understanding technology will basically apply to that narrative. It'll extract those facts. It'll present the facts back to the physician, and the physician will look at them and say, yep, that's what I said, and then click the magic button, and those facts will get pushed back into the electronic medical record. So the ability for a physician to interact in a natural way, i.e. to tell a story like a human being would, and then leverage technology as a productivity gain to extract facts and then achieve something like meaningful use. This really is kind of the holy grail of increasing adoption and reducing some of that distance that has been established because of all the stuff that's happening out there, between the physician and the patient. And then I think those things that I said about mobile form factors and the ability for a physician to have exactly the same experience on a mobile phone or an iPad or whatever. They're just like all of us, right? They're mobile. They're on a weekend night they're going out to the movies with their family or whatever, and they get buzzed and they pull that iPhone out. Now from an EMR point of view, they can pull up the EMR. They can actually look at it on their iPhone if they want to add a note or place an order or whatever. They can click the little microphone button and speak to it. Hopefully while they're in the passenger seat. And this kind of ability to support the physician on whatever form factor they're on, whether they're in their cafeteria or a car or sitting in a library or a meeting, I think another key to adoption. So really, in the end, what we're really trying to do is get the physician back closer to the patient with all of these things that we're bringing to bear, and we think we've got a lot of success relative to that. That's why those 450,000 physicians are using it every day.
Well, it seems it truly is the holy grail of these innovations and technologies coming together. And I think we have a lot to look forward to in terms of voice recognition, natural language processing, and what that's going to mean for the industry and for clinicians and practitioners, down the line. So thank you so much, Joe, for taking some time out to chat with us today. I really appreciate it. And thank you for sharing your expertise with our community.
You're welcome. We enjoyed it.